From an Army officer who is medically discharged to co-founding and growing a unicorn digital health startup, Ambitious Vet, how do you find your billion-dollar purpose through leveraging the soft skills you already have? To find out, stay tuned.
Before us. And when you look at the healthcare industry, that is nearly 20% of our GDP, you look at social care industry, both are $3 trillion plus, and we're zippering them together. It's a really big undertaking that is going to move our healthcare system from a sick care system to truly focusing on health and truly addressing all of those needs that go into someone's overall health and well-being. And
Want to help us shift how veterans are viewed in the marketplace? Join the fight now by supporting our qualitative research in partnership with University of Texas San Antonio, where our mission is simple: to serve the 65% of post 9/11 veterans who are leaving their first post-military careers and understand how to write a freaking resume and interview prep and know how to attend job fairs. The key thing here, Ambitious Vet, is you've got to go learn more. Educate yourself. Click the link in the show notes below. Let us know how you can join the fight in any regard, whether it's support and funding, connections, or distribution. Just let us know, as this won't be as successful without you, right? As I like to say in other coaching programs that I've coached in the personal and professional development world, you are the one. Don't look to the left and right. In the trenches, you were always the one willing to jump on that damn grenade. Am I right? Right. You're the one to jump on this grenade. In this case, it's the golden freaking grenade. Click the link in the show notes below and let's finish the freaking job and supporting other ambitious vets to self-actualize.
It's time to get into the trenches, dig into your purpose, and fire up your life's fulfillment. The Ambitious Vet Podcast starts now.
What's going on, Ambitious Vet? We are right back inside the trenches today with Taylor Justice. Taylor is a U.S. Army veteran, graduated from the United States Military Academy at West Point in 2006. He was commissioned as an infantry officer and later received an honorable medical discharge from active duty. Taylor co-founded Unite Us in 2013 while enrolled at Columbia Business School, where he earned his MBA in 2014. Taylor is now leading Unite Us on its mission to launch coordinated care networks in every county of every state by 2023. Together with his co-founder and team, Unite Us has raised over $150 million in Series C funding, Ambitious Vet, bringing the company's total valuation over $1.6 billion and accelerating Unite Us growth, product development, and community investment capabilities. Just remarkable work. Taylor, welcome to the show, brother.
Appreciate it, Chris. Thanks for having us.
Yeah, man. Like I said offline, just completely humbled experience, completely honored to have you on the show. But for an ambitious vet that may have not heard of Unite Us or Taylor Justice, go ahead and fill the gaps inside of that introduction. Let us know about who you are.
No, appreciate that. So as you mentioned, I was a U.S. Army infantry officer, and our journey here at Unite Us started with personal pain points of myself and my fellow co-founder, who you just saw walk in the back there. We both had our own personal story. Mine was I was unfortunately medically discharged. So coming out of West Point, you have a 5-year active duty commitment, 3 years in active reserve. I've made my 3 years of inactive service active because I was part of that 10% of our West Point class that made the other 90% possible. So I had to add so and give extra years to make sure I was an infantry officer. But unfortunately, my career finished before it ever started. I was medically discharged before my 2-year mark, and navigating the VA, finding a new job, finding a place to live, just live the inefficiencies of that process. So Unite Us started off initially focused just on the veteran and military community, connecting individuals to resources in their community. And that's went across a host of different services: education, employment, housing, legal, finance. And I really started to see the need as a volunteer through an organization called Team Red, White, and Blue, where I was part of the founding team of Philadelphia's chapter, which it's a national nonprofit, but this Philly chapter was a core group of us that started it, and people were coming in with needs outside of what we could facilitate, connecting to these different community-based organizations and veteran-serving organizations, and the navigation process sucked. It was miserable, and I was already a volunteer for Team Red, White, and Blue, and then this other component, because you don't want to anybody to fall through the cracks. You want to take care of them. It became another job on top of this Team Red, White, and Blue work on top of my full-time job. And I was actually looking for software that would actually help me just handle the volume and ensure, did this person receive that care or not? And it didn't exist. So Unite Us was formed to build an ecosystem that allowed all of these organizations that wanted to support the veteran and military population to securely exchange data with each other. And so Unite Us is a software platform that connects health, human, social service agencies into a common ecosystem where now they can support any individual. It's not just veterans anymore. We've expanded the platform to service all Americans, all populations that need to connect to these basic need providers. And we're building that infrastructure, that software infrastructure across the country.
That's amazing. And all this came from a flyover state country boy from Kentucky, right?
Yeah, I mean, I miss that. I mean, yeah, I grew up in a real small town in Kentucky, in Grant County, in a small town called Crittenden. Lived there till I was 12 or 13. Ended up moving to Florida. That's where I got introduced to football, and that's actually what got me to West Point. I played football at the academy, but I think those Kentucky roots taught me a lot. When you're from a small town, everybody takes care of each other. Everybody knows each other, but everyone locks arms and solves problems, even if you don't have all the resources. And I think we at Unite Us has kind of taken that experience and digitized it, where you don't have to have that oracle anymore from your local church or the local nonprofit organization that just knows everything about everybody.
Yeah.
We bring everybody up to that same playing field, so we can take care of more people faster.
That's awesome. And it's cool because you guys have been able to bring those core principles that were ingrained into you from the Midwest, and put that and digitize those. And I think a lot of people don't think that you can digitize like values, right? And you guys have been doing a great job as far as doing that and translating that in technology. It's amazing work.
No, I appreciate it. It's been interesting. I mean, I think the military teaches you a lot of skills, both soft skills and hard skills. The best one though is dealing with ambiguity. And seeing that, you're always taught, no mission survives first contact. And so at that point, you're then in creative mode to assess the situation, address the situation, and execute. No decision is the wrong decision. So you just move out, learn, and be willing to pivot. And I think we've tried to take that same philosophy here at Unite Us, where we're in an emerging market. Like, this didn't exist before us. And when you look at the healthcare industry, that is nearly 20% of our GDP, you look at social care industry, both are $3 trillion plus, and we're zippering them together. It's a really big undertaking that is going to move our healthcare system from a sick care system to truly focusing on health and truly addressing all of those needs that go into someone's overall health and well-being. And it's a cool environment to be in. It's a great environment. Being a veteran of continuing to serve, I found that sense of purpose again that I felt like I had lost for a while when I was transitioning out and trying to kind of find my way. And this is my chance to serve.
Yeah, no, that's great. I love how you got the information, you got the spark, and then you went back to Columbia University to get your business degree to make it happen, to gain the tools. And I think a lot of ambitious vets, when they get out of the uniform, man, they get those big visions, they get those big goals, and then they start falling down in like entry-level roles or whatever, and then they just kind of give up. Or they're just like, all right, I'm going to go back and re-enlist. But not you, brother. You hit those moments, but you were just like, all right, well, this is my aha moment. And I'd love to get to that here in a second, around when you got that $1 billion idea in that nonprofit, and walk us through that. But brother, you didn't let that stop you. What you did is you got the aha moment, and then you went to go and gain the human capital to be able to execute on it. And then you just did a great job as far as attracting the right people around you. And you can talk more on that or the aha moment if you want.
Yeah. I mean, I think they're both intertwined. And the one thing that I feel I learned late is that there's never that one thing that is the catalyst for the next. Everything's a journey, and all the small steps and the small details and the small actions over time turn into something really big. But you have to understand where you're trying to go, what's your vision, what's the mission that you're looking to accomplish, and be very, very focused on that, less focused on how you get there, because you're always going to be thrown curveballs. You're always going to be thrown things that you weren't expecting, and it's how you handle those situations. And there's usually just a handful of them, but it's how you handle those very difficult situations that ultimately make the big difference. So the aha moment for us was we saw a problem, and we wanted to go solve it. And the first thing that we rolled out was the wrong thing. We went and raised $2 million of our seed round of funding off of a couple pieces of paper. Had a pitch deck. And we were very passionate about what we were trying to do. We thought we had a really solid plan. We just recently presented to the entire company once we'd made the announcement that we'd kind of hit this unicorn status and whatnot. We went back to like the very first pitch deck that Dan and I had, and it was embarrassing of how bad it was because it was, we thought we were going down this one path, but I think that's the aha moment. If you have an idea, the hardest part is taking that first step, and then that second step and that third step and that fourth step, and being willing to pivot when need be. When you're like, okay, maybe I'm going down the wrong path. I'm not going to, put bad money after bad, or I'm not going to double down on this bad idea. Hey, we got it wrong. We're still here. We have resources. The first product we built was, we felt if I gave veterans all the resources that they needed and put it on a pretty map, I was going to solve the problem. What I didn't realize was that didn't actually make a connection. There's no accountability of that organization that I'm making a list of, and they're not going to know that my brother or sister is going to need this service because it's going into some email account, some black hole. And the beauty of the veteran and military community is they don't let you blow smoke. So they told us it sucked. And we realized that the problem was not people finding the resources. It was how to navigate those resources and navigate them effectively. So we flipped the model on its head to initially not focus on the consumer. And we felt the best way to focus on the consumer initially was to focus on the supply. So if I can go find those organizations that provide the service, have them operate more efficiently, understand what their eligibility are, I can get people to the right service the first time quicker. And then that creates a better experience for the person that's in need. Yeah. And then you can move backwards from that. And so the aha moment was we had the idea, we moved out on that idea, but we didn't settle to say, oh, this idea is the greatest thing since sliced bread. We're always working on it, and we're always massaging it. And even today, like we've seen a lot of success lately, but we're just scratching the surface. We have a long way to go. And so as part of building out that plan, you have to realize what your skill sets are, what you do well, but also what you don't do well. And I think Dan and I as founders are a great yin and yang of what we focus on, how we see the world. We had to work on how we communicate with each other. And then we went and found leaders, a part of our team, and teammates that filled in gaps that we didn't have: technical expertise, account management expertise, implementation expertise, operations expertise. There's a lot of different things. And then you recruit that team to say, hey, we have this idea. This is where we're going. You want to be a part of it. And we were just fortunate enough that enough really smart people in the early days said, yeah, I think you guys are onto something and I want to be a part of it.
Yeah, it sounds like your guys' process was solid from the very beginning, right? We have a saying over here that, failure to proper plan, right, is planning to fail, right? You've got to have the plan out from the very beginning. And you guys have quite a lot of margin for error with the capital that you guys have raised. So congratulations on that, brother. So, and on behalf of the whole veteran community too, just thanks for streamlining vetted resources from the very beginning, because there's over 45,000 veteran service organizations out there. I know you guys have pivoted to vertical markets and stuff like that, but like, just thanks for what you guys are doing, because I remember when I got out of the United States Marine Corps in 2012 and I walked by those wall of brochures.
Yeah.
You know what I mean? And just a lot of those resources, didn't provide me the perspective that I needed to leverage them.
Mm-hmm.
So just thanks for digitizing that whole experience, because it just helps out so many ambitious vets who want to accelerate their next stage of life, man. So just
That's
thanks.
right.
Yeah. Thanks for that. Yeah. So, yeah, brother, thanks for sharing all that. So,
do you struggle with your payroll processing or other HR compliance needs in your small business? If so, check out Get Payroll, a Vietnam veteran-owned company who has been in the industry for over 30 plus years and is now disrupting the fintech industry with his payroll app, Ambitious Vet. Also, Get Payroll provides seamless integration with the online payroll, the HR, and the timekeeping solutions for businesses of all sizes. Get Payroll is the only company in their space to have a U.S. tax court practitioner and CPA on staff to ensure 100% compliance. Also, once you sign up, will have a dedicated payroll service specialist based in the U.S. that is assigned to you for you to talk to anytime you have a question. And get this, if anything happens as a result of their processing, they will take care of anything that has to do with employment tax regulating authorities, including the IRS, 100% guaranteed. So Ambitious Vet, if you're ready to learn more, click our affiliate link in the show notes below. And now back to the show.
Walk us through social determinants, man. When I was doing pre-work here, I was just, man, I always tell ambitious vets, know the rules of the game before diving into your desired industry or market.
Mm-hmm.
But like, this is a brand new terminology for a new market that you guys are spearheading inside us. Walk us through this new problem called social determinants and how you guys are solving it.
Yeah, so social determinants is an interesting term, and I think as we were talking before we started here, Unite Us was probably 2 or 3 years into our work, and this term social determinants of health popped up. I think we first heard it through a consulting firm, and once somebody explained social determinants of health to Dan and I, were like, oh, we've been doing that for the past 2 or 3 years. And the term SDOH is really coming from the healthcare market, because again, healthcare is 20% of nearly 20% of our GDP. The community doesn't call it social determinants of health. They just call it their work. That's what they've been doing for decades. And really what encapsulates social determinants of health is when you look at someone's overall health and well-being, social determinants equate to 80% of that. 20% comes from the clinical setting. You go to your doctor, you go to a hospital, you have a specialist, those things. But SDOH is where you live, you work, you pray, you eat. It's all those basic needs. Do I have a roof over my head? Do I have food in my belly? Do I have access to an employable wage? Do I have those basic necessities around me so that I can be self-sustaining and sufficient? And in certain cases, in certain populations, and even certain geographies, the access to those services isn't readily available. You have communities that have food deserts. You have communities that don't have many or enough employment opportunities. You have housing restrictions and things of that nature. And what we realized is the human and social service landscape historically has a negative view on it. It's considered charity, and it's not. It goes into 80% of us just being healthy, those basic needs, and not everybody has the appropriate access to those. And that industry in and of itself was kind of lagging from a technical perspective. You mentioned it, wall full of brochures. We've all been to a primary care doc. If we've been in the military, you have that. And if you gave somebody that resource, you send them on their way, you have no idea, did they go? Were they able to connect? Did they actually receive a service? And majority of the human and social service landscape is like that because it's fragmented. If they have technology, it could be as simple as an Excel sheet. A lot of people are trying to coordinate through phone calls and emails. That's fine if you have 1 or 2 people you're trying to take care of. What happens when that turns to 10 or 100 or 1,000? becomes unmanageable and becomes an administrative nightmare.
Can't scale
So
it.
what we've, you can't scale it. So what we've done is build an ecosystem that brings human and social services into the 21st century with technology that allows them to operate at the top of their license so they can be at the same priority level as healthcare. And, you know, when we first got this going, people were like, that doesn't exist. I'm like, no, it doesn't. And 2020 highlighted that for state governments and federal government, that, you know, the second and third order effects of the pandemic and the clinical response to it was this unprecedented stress we saw on the human and social service landscape. You know, you had children that their food supply was going to school. Well, school shut down. So now their food supply is gone.
Wow.
You had people that lost their jobs. And so states were saying, okay, now we need to respond to this. And in 2020, at the beginning of that year, we had one statewide infrastructure, meaning we were already in a number of states across the country, but it wasn't a statewide procurement. North Carolina was that for us. We were in all 100 counties. We're contracted with all 100 counties, working with the plans, working with systems, working with state government. 2020 drove the need for appropriate public health infrastructure that we replicated the North Carolina network 16 times, in addition to other enterprise-wide solutions that we had with Kaiser Permanente and our work with CVS Health, United Healthcare, and all these other groups. But really, we're building this infrastructure. So you said as part of the intro, we're building the pipes in every county, every parish across the country, and we'll have that complete by the end of 2022. You know, that's really driven the need here from our perspective, because it's such a needed tool that allows us to make sure people are taken care of. And again, that all started with veterans, and all of our veteran networks have then transitioned into broader population. So, you know, people are like, oh, you pivoted away from veterans. No, veterans have always been our flagship, have always been our starting point. They were just the tip of the spear that made all this other stuff happen. You know, all of those veteran networks have now been subsumed by statewide infrastructure, which is a beautiful thing to see, because now you're connecting them not just to VA services and veteran services, all those other services that they didn't know that they had access to as well.
Yeah. No, I love how you guys are, correct me if I'm wrong, but it also seems like you guys are accelerating the bureaucracy throughout this whole thing too, right? You know, connecting, you know, potential like local civic organizations to the government, to healthcare providers, stuff like that. Some local civic organizations, you know, there's a lot of bureaucracy to get into that. So
yeah,
I mean, are you guys?
Yeah, we're trying to. I wouldn't say accelerate the bureaucracy. I'd say we're trying to eliminate the bureaucracy. So we go figure out the red tape so that the community-based organization, the veteran, the family doesn't have to.
Yeah.
And so if we can streamline that manual process today with, again, technology that keeps it secure, that doesn't just share your information with everybody else in the world, but allows you to identify, here are the resources in my community, here are the resources that I'm a fit for, that have capacity, that are open, that I can go connect to right now. We're trying to eliminate bureaucracy with efficiency.
That's amazing. That's a lot better way that I could ever put it, brother. So that's amazing work though, streamlining the process, helping, you know, veterans or local civic organizations that are underfunded or just don't have the resources, helping them find those resources. So as I was saying before this, we had an ambitious vet inside our Facebook group that was just like, wow, you're interviewing Taylor Justice, right? And she's just like, man, I'm a local civic organization in the middle of Colorado fighting cystic fibrosis for my younger son through a CBD research and development practice there. And she was just like, what are some of the lenders in the local counties that you guys are currently targeting? What are some of the vendors that you guys look to partner up with as far as demographics, or fill in the blank? What are some of the vendors that you look to partner with?
Yeah, so we tag ourselves as community-wide care coordination. So we stole care coordination from clinical environment, where you go to your primary care doc, you know, they have the ability to connect you to a hospital, to a specialist, to a pharmacy. All of that happens within infrastructure. We just extended that out now to these human and social service agencies. But when we say community-wide, we mean it. Anybody that is providing a service where an individual might need a secondary service that they don't provide within their building is an organization that should be a part of one of our networks. And we offer our software to community-based organizations and the individual that asks the question for free. Doesn't cost them a penny. Because we want them to be an access point. And as they provide services to their target demographic, they're ultimately going to identify their services that this individual or this family needs that they don't provide. So how do they make those referrals? We want them to do that across Unite Us. So in other markets, we have barbershops that are a part of our network. And you're like, why in the world do you have a barbershop as part of one of your care coordination networks? Because that's where in certain communities, people congregate. And when you talk about people having the ability to break down their walls, be comfortable, feel secure, and ask for help, we want to be there when they're willing to have the courage to make the ask. And sometimes that's at a barbershop. And that barbershop might not provide the direct services that you would historically think around SDOH, but they're a great conduit into the network. And so we see a world where you go to your local laundromat, you go to your local gas station, you go anywhere, and you are looking for services. That could be an access point that you can connect better to your community, because again, we're digitizing those community relationships from small town USA, where I grew up, and create an ecosystem where now every door is the right door. It's going to give you access to a larger network. So we look for anybody and everybody to participate within these networks. We're building out in Colorado at the moment. We have a pretty strong team out there. We're going to be statewide, I believe, by the beginning of next year. And if they would want to participate, I'm sure you'll have some contact information of how people can reach out to me or go to uniteus.com. We'll get them on board and get them set up.
Yeah, awesome, Taylor. So speaking of which, where can an ambitious vet go find out about more about you and Unite Us platform, how to get involved inside of it, or even just be like, hey, I'd love to even participate within their organization? Where can they go to find out more?
Yeah, uniteus.com. We have a host of different resources there, one to explain around what we do. You can see the team. But we also have a number of different blogs and assets and intelligence on the market, what we're seeing, some of the trends, policy, things that are coming down from the federal government at the state level. And we're on every social media platform out there. Our handle is just at Unite Us HQ, just like my handle is at Tay Justice on, insert social name. I'm there.
Right.
Feel free to reach out, and we'll have a convo.
Awesome. Well, Ambitious Vet, all those links will be in the show notes below. So make sure that you get in the trenches with Unite Us and making sure that we are getting what we need in our local communities from the ground up. Taylor, is there any other parting words for the Ambitious Vet Network before we say goodbye?
Yeah, I mean, I think you said in the prep call around kind of the golden grenade or like a piece of advice.
Yeah.
And there was something you said in the very beginning around people that are transitioning and, they might get an entry level job or whatever it is. You start a business or you go work for a business. There's going to always be ups and downs. And as a veteran, I think dealing with ambiguity and being able to overcome adversity is kind of in our blood. But there's something that I think has driven me of never being satisfied and always having a chip on my shoulder that I have something to prove. And I think if you take that with you, regardless of what role you're in or what's thrown at you, good or bad, never be satisfied or never believe your own hype. You always have to continue to push and always have to continue to prove yourself regardless of what happens. And I think sometimes vets can miss that. I think that, your listeners are probably right in tune and they totally get it. But at times you see folks that get a little bit of success and it gets away from them. And they start to believe their own hype. And at the end of the day, I think that's a recipe for disaster. So always go prove yourself regardless of what role you're in.
Definitely agree with that. And it seems like Philadelphia may have put that in your DNA.
Yeah, a little rocky, right?
Yeah, a little bit, man. A little bit. Well, Taylor, thanks for joining us on the Ambitious Vet Show. You're doing amazing work, and thanks for just spreading the footprints for the rest of the Ambitious Vet Network to follow. Thanks for joining the show, brother.
Thank you, Chris.
The Ambitious Vet is available on all popular podcast platforms. Go to vettrainingcoaching.com to subscribe, rate, and share with fellow vets.
Ambitious Vet, before you go, if you're ready to help us shift how you're viewed in the marketplace, and if you're a government entity, leader inside the DoD, DOL, and you're listening to this, or an HR manager within a Fortune 5000 company, we war cry to you to come and help us help you stop the finger pointing once and for all, and come and support the education and the data that is missing within the veteran community, specifically within the post 9/11 veteran demographic, that's stopping them from self-actualizing sooner and will definitely limit the suicide rates within the community. I know it's a bold claim, but if you're ready to learn more, click the link in the show notes below, learn more, and just let us know how you could help us out. If it's connections, distribution, sharing it within your social media platforms, or simply funding, just let us know. We know we cannot be successful without you, Ambitious Vets. We've been doing this since early 2017. We've scaled this to over 10,000 listeners. I know I don't brag about that because we're more focused on the mission, but you are our voice. You are advocates. If not you, who? Right? So click the link in the show notes below. Until next time, hold the vision and trust the process. Take care.